Um, Good afternoon. I'm Anna Fleming with Prisma Health, and I'm here just to briefly talk to you about some of the work we've done over the last couple of years around executive buy-in for our workers' comp program and some of the successes that we've had by doing that. So just a little bit of background. Of course, Prisma Health, we've got 12 hospital campuses. We're spread out, from Toomey, Sumter, all the way up to Oconee. We've got multiple physician practices across both the Midlands and the Upstate. We were a merger of Greenville Health System and Palmetto Health. So Greenville Health System had many years in the trust, has been a member for a very long time. And when we came together as Prisma Health, we made the decision to join as an organization. So as Prisma, we have been a member of PHT since 2019. We have 2 workers' comp coordinators. So we have a coordinator who handles each market. We have 2 what we call uplift facilitators because we love an acronym. So those are our folks who focus on safe patient handling. We have an exposure control nurse for the system. And then we have a really close partnership and collaboration with our safety department. So Pam Klingerman is here in person. I know Maurice Dudley was on earlier. As well as our HR business partners. So I think Lynn Hearn might have been joining from HR. So just want to acknowledge that it's not just employee health, that we've got a lot of close partners as we look at injury prevention within the organization. Okay, now I'm trying. Okay. But we also have some challenges, right? And probably the most significant challenge is that we are a huge organization with, close to 30,000 team members spread out over a pretty large geographical spread. So, when we look to align processes and policies and, best practice, sometimes that can be challenging. We also recognized when we came together as Prisma and we joined the trust and we got to start looking at some of the risk reduction objectives that one of our markets did not have all of the technology and equipment that our other market had. And so we recognized pretty early on some opportunity for alignment to make sure that all of our team members had access to equipment and policies to protect them. So we had opportunities. So it was really good timing because about the time we came together as Prisma Health, we also had a new senior vice president who was over all of our acute care operations for the system, who was very interested in employee safety. So of course, we always jump on any opportunity, right? Anytime I'm getting emails from senior leaders wanting to know about injury rates and, all of those things, like, yes, we will provide you data. So we had the opportunity in 2020 to meet with all of our hospital CEOs and CNOs just to talk through our workers' comp program, to talk through some of the injury prevention strategies that we already had in place, and then to talk through some of the opportunities to really expand those efforts. And part of the direction in that meeting was that each of those campus CEOs, CNOs really need to own for their campus, I'm going to say team members because that's what we say, but employee injuries and understanding, who was being injured on their campus, why they were being injured, how we could prevent that. So we were able to partner with Wendy here at Antum to provide executive summaries to all of our campus leaders. And those are presented to the campus leaders on a monthly basis by our HR business partners. So we have an HR business partner model where we have business partners who support the campus and who are teamed up with the CEOs, CNOs. And those business partners go through those reports with the campus executives. Something else we implemented and our campus leaders really seem to like this is instant notification of injuries. So we've been able to, in partnership with Antum, customize those so that if we have an injury on our Oconee campus, for example, whoever the leadership team has designated as receiving those notifications gets an instant email that just says, hey, doesn't have the team member's name, but it just says, here's what's happened. As soon as that eSTRIO is submitted. And that generates a lot of conversation, you know, and kind of immediate conversation. So it's kind of skipping, you know, certain levels of leadership and getting right to that senior exec who's like, wait a minute, you know, what just happened here? Time out. You know, what can we do to prevent future injuries? Our CEOs and CNOs are really focused on the TCIR, so the total case incident rate. So in partnership with Wendy, you know, we've been able to provide the number of hours worked on a quarterly basis for our team members, and then Wendy calculates TCIR is intended to be an annual measure, right? But we've sort of come up with a way to annualize that and look at it on a quarterly basis. And it's become somewhat competitive, right? So our various campus CEOs can see where they fall compared to, you know, every other campus. So the goal is to get all of our campuses to a TCIR of 4 or under. And I will tell you, of course, we roll all this out, and then, you know, COVID's happening, and so that's really kind of made numbers challenging. But this just kind of gives you an example, and it's really small, but it's a 1-page, you know, report that goes out each month. It just kind of gives each campus a snapshot of what's causing their injuries. So what are the causes, you know, slips, trips, falls, patient handling, exposures, what the cost of those are. We look at it in a rolling 12-month period so that they can kind of get a sense of how those numbers are trending. At the bottom left, it tells you, you know, by department, so you can see which departments have the most injuries. And then that bottom right shows that TCIR, and I blacked out campuses, but you know, it lists all the campuses, and each CEO sees again where the other campus leaders are. In addition to that monthly snapshot, on a quarterly basis, Wendy also gives the patient handling, needle stick sharp, slip, trips and fall, and workplace violence dashboard as part of that report. So they're able to have visibility into those. And then our HR business partners and our employee health team have full access to all the detail behind this, right? So as we're sitting down, as conversations are being had with those campus leaders, and they're like, wait a minute, one thing I forgot to mention at the top left, it talks about the average number of days, you know, that it's taking for team members to report an injury, and the average number of days it's taking for supervisors to follow up. And so, you know, if our campus leaders want to know, wait a minute, you know, why is it taking supervisors this many days, we can dig into the detail behind that. And we can say, well, you know, we've got one leader who, you know, just hasn't responded to these in so many days, so that they can figure out the best way to partner with that leader to help them understand the importance of doing those timely investigations. So after a year, so we're a year into sharing these reports, I can't say that it's had a direct impact on the number of claims yet. I mean, our goal would be that over time we'll see that. Again, I think with COVID, it's just been very challenging. But some of the wins we have experienced, number one is we were able to kind of use this data, combined with the risk reduction objectives to identify funding to roll out safe patient handling in our Midlands market. So we completed all 4 of our campuses in the Midlands. I guess we just wrapped that up in this year, 2021. We also were able to get funding for safety shoes. So we subsidized the cost of safety shoes as part of our uniform policy rollout, and that's again system-wide. Pam, who just walked back in, this assistant, you know, Pam sets up goals for us as part of the safety committee, and so really this drove what our safety committee goals were related to team member safety. So we wanted to make sure it was something that the CEOs, CNOs had high visibility to. So it was just helpful to drive, to align. So we're kind of all talking off the same page and looking at the same numbers. And then campus wins. So, you know, it's fun to join. I mean, obviously each CEO runs campus meetings differently, but it's been very interesting to hear our campus leaders talking more about team member safety, and to the point that was made earlier with, you know, when we're talking about sharps injuries, and the focus on patient versus employee safety. It's just nice to see that visibility. Probably still not, where we would want it ideally, but making progress towards that. It's also led to additional requests for training. We've had some campuses who looked at the numbers and they're like, wait a minute, we probably need to do some re-education with our supervisors and make sure they know how to use the eStrio tool. So we've seen a lot of wins, and like I said, hopefully in a couple of years down the road, we'll also see a direct correlation to our claims and see those numbers come down as well. So that concludes my presentation. Any questions or comments? Great. Well, thank you all. I appreciate it.